Dr. Philip Yu at the 21st Century Regenerative Medicine Institute, and today I am doing an experiment on myself. We're testing a new umbilical cord blood stem cell company's allograft product. I always want to know if it's effective before we recommend it to our patients. So I'm treating my own chronic plantar fasciitis heel spur, which I've been struggling probably ever since 1993-ish, when I first was doing a lot of plyometric jumping, and when I first got the heel spur and plantar fasciitis was so bad I couldn't walk right for like 6 months because of the pain and inflammation. So it basically causes it is several things. When you have a strain of the plantaris longus muscle here, the origin is on the medial side of the calcaneus, and with plantar fasciitis, you could have overpronation, straining here. Tight calves can cause it because the Achilles tendon, which attaches to your calves, is like a pulley because that's attached to the calcaneus too. So when your calves are tight, it tears away at this muscle because it's a pulley mechanism. That's why it's worse in the morning, the first few steps out of bed, because when you're sleeping, your calcaneus is relaxed with your Achilles tendon and your calf. So it's like they're tight, right? Because you sleep with plantar flexion. And then when you take that first step out of bed, look, it puts strain on that origin of the plantar muscle, and it causes micro tears. When you step on it again and again every morning, more micro tears, inflammation, osteochondritis dissecans, more of a myositis ossificans. The tissue becomes very hard, calcified, thus the heel spur. So we're going to graft 1 cc of cord blood, no sodium bicarbonate. I want to know that these cells are the ones that doing the healing. So I'm going to go ahead and mark the cells on myself with laser guidance. So let's see. The main point of pain inflammation is the medial calcaneus, where the muscle originates. So it's normally tender here. And I'm going to mark the point of greatest inflammation because that's where the cells will be attracted to with the cytokine signaling. Can I have that other thermometer? I don't know if this is calibrated or not. The temperature's just all over the place. I think it's working now. You see that's 62.5. This one, yeah, this one's more accurate. So you could see if we go posterior, got about 81 right there. That's inflamed right there. It's even swollen at 85.1. So that's one point we're definitely going to graft. That's a nice point. What happens is when you get some arthrosis here, the point is actually cold because there's no blood flow in there. But I still want to, inject it right where the spur is, right here.
Okay.
Temperature. Yeah, 80.4. Definitely that guy right there. And I do have pain as we go towards the front of the foot sometimes. Look, my foot is getting all shaky and nervous. Look at that. And laterally, I do get pain too in the morning. It gets so bad in the morning, sometimes I just limp. And then I have to wear like some sandals to, increase the height so my Achilles tendon doesn't have to dorsiflex so much because it gets so shortened in the morning. Here's a point right here. Kind of the base of the 5th metatarsal. It's a big area as well. It's a little more inflamed, right there, 1.6. Let me see if there's any points, hot points over here. That's the lame one. That needs to be Can you put this away? It needs to be calibrated so we don't use it. All right, there's a spot. So Michelle, we'll do 0.5. I'm sorry, 0.25 in each, just to spread it out evenly. Okay. Okay. And you will use cryo spray. And if you could swing around this way so you could film her grafting those cells.
It's very vascular.
Or you could go to that against the window so you could see the bottom of the foot, please. You could, yeah, just put it right against the window.
Try to go easy on you. The foot's very vascular.
Well, remember we did it on Mike the director. He survived, so I gotta know what it feels like. All right. And maybe get a cotton swab ready in case we hit a blood vessel, which we almost never do.
Where's my trial? I saw it.
Lisa, do you want to be our assistant nurse? You have a nursing degree, don't you?
Yeah.
Yeah. Okay.
No license.
You're gonna be our dabber in case we get any blood. Do you want me to dorsiflex to make it tighter, the skin?
That's a good idea. I'll spray you one more time. Is it really cold?
Where are your gloves at?
Yeah.
There's some there. Okay. Going in. That's it.
Mosquito bite. Yeah, that's it. I call it the bloodless mosquito bite procedure. Rarely do we get a drop of blood, and rarely does it hurt more than a mosquito bite, at least going in. Yeah, as the fluid goes in, you're gonna feel it spreading around and kind of like a tingly, electric-like sensation to the big toe, because that is going along the musculature of the
Do you need it dabbed at
Plantar's
all?
longus muscle. Not a drop, right?
Not a drop
Wow.
there.
We're pulling out of retirement, Lisa. Right.
Here, I'll give you the Band-Aid. Get to that. Then I'll
Okay.
So that was what, 0.25, correct?
Right.
All right. Now we'll get the heel spur.
This is where it's most painful.
Yeah, it's a mosquito bite. You're good.
Might feel this one a little more, because the skin is, like you said, it's a little.
I mean, it was a mosquito bite going in. I mean, now that is tougher tissue. Is there any more resistance or?
There was at first.
Yeah, but once you're through that.
Thank you. Band-Aid. Yeah, that's the cells.
Yeah, it's the cells. That's not even the blood. Yeah. I can't believe I put 2 more spots there. Making myself.
Would it be easier from this side to get those other two?
Yeah, probably for her. Or do you want me to move my foot this way?
No.
Yeah, you can stand over there. This way? I can go like that.
No, I can still reach
Okay.
it. The top one, but the lower one I'll move. So I'm doing the upper.
Yeah, just getting whatever ergonomics you need to.
Well, this might be a little more vascular here. Deep breath. more nerves in there.
0.25 there.
Got our Band-Aid.
Yeah, you feel more kind of a like burning sensation once it's in. So it's not the needle, it's the grafting, the fluid, as it's spreading around, you know, the whole, because there's 7 layers of muscle in the bottom of your foot.
Skin's tougher here. There. There we go.
And we are done. Look at that. So normally we would do some myofascial release therapy. We would do some light stim elation. But this time I just want the pure cells. Again, we did not mix it with sodium bicarbonate, which makes an alkaline environment. I just want to see that this new stem cell company, these cells are effective, they're viable. They're claiming 1.5 million mesenchymal stem cells per cc, which is more than enough to fix plantar fasciitis. So I'll give it about a month to see. Actually, I only have 3 weeks because I'm doing another Spartan race. It's the Big Bear Mountain, like a 12-mile course, uphill with all these obstacles. We'll see if we survive.
You'll be ready for it.
All right, thanks for watching.
Thank you.